Hey everybody, hope you're having a great Friday. It's Eddie Campos here, and I'm at my home away from home at the Maumee Chamber of Commerce office. I'm hanging out with Dr. Stephen Bills and my friend Kristen Meyer, and Stephen was just telling me about a new business that he started. I think it's really exciting. I think it's something that's very necessary for busy family lives with kids and sports, and it just seems like we're taken all over the place these days, and sometimes can't easily get into a hospital or emergency room or any place that can take care of us. So he's got a really cool new business that he started I wanted to tell everybody about. Stephen, how are you?
I'm fine, Eddie.
Good. So tell me about TeleMeMD.
Well, TeleMeMD is a concierge service where I basically bring the urgent care to you. You don't have to wait in a waiting room or busy doctor's office. We bring everything that you can do in an urgent care or a doctor's office basically to you.
So just like in the good old days, doctor comes and makes a house call.
Yeah, my dad made house calls when he was first in practice back in the late 50s.
Really?
And my brother can remember going on house calls with him. He had quit doing them by the time I came along, but it's kind of old medicine meets new. We've got the newer technology with the advent of video conferencing and telehealth type of models. We can basically do both. So we can handle it over the phone with a telephone conference or a video conference. That's great. But there are some things you just have to go lay hands on people.
Right. So what was your inspiration for doing this? You had been an emergency doctor for 29 years, right?
Yeah, I've been a doc since for about 29 years. Thanks for bringing that to my it's actually something that's been in my mind for a long time. I've pretty much been doing this all my career. You get the phone call and the friend says, hey, I've got this laceration on my hand. You don't happen to have any supplies at home? Well, as a matter of fact, I do. I'll be right over. But honestly, I think there have been some key points in my life that kind of led me to look at this model. One of those was a time you may or may not know that my wife is a florist. She owns In Bloom Flowers and Gifts just around.
Go there all the time.
So I was delivering flowers for her on one Valentine's Day, and because small business owner, need an extra set of hands. So I went to this lady's house to deliver some flowers, and she came to the door very distraught, and she invited me in, and she said, "Can you help me?" She said, "My dad has Alzheimer's, and he's fallen in the back, and he's bleeding, and I can't get him up."
Oh my God.
And I said, "Sure, yeah, no problem." Put the flowers down, went back and kind of assessed the situation, and she said, "Well, I bet you don't see this every day."
Little does she know.
And as a matter of fact, I said, yeah, actually I do. I'm an emergency physician, and I see this all the time. And she says, "You're delivering flowers?" And I said, "Yeah." I said, two reasons. Number one, I said, my wife needed some extra help. But number two, I really believe that God led me here today to help you with this situation.
Yeah.
And so we kind of started digging in and found out what his true needs were. She was taking care of him. The rest of the family didn't want anything to do with him. She was having to run to the grocery store and then come back. In the meantime, he would fall. And I said, you can't continue doing this. And so we helped her set up a shower chair for her and talked about what kind of help she could get in the home. And I realized that emergency medicine and other types of medicine, we look at people by what their problem is. So he's the older guy who fell and injured himself, and he needs his wound cleansed and then go home. And I'm missing sort of like the iceberg. You're only seeing this much of it when there's so much more underneath the water there. And understanding what the true need of this guy was really made me start to question how we really do medicine in this country, and why don't we have a better understanding and better relationship on what's going on.
Yeah, because it sure sounds like in that scenario that there should have been some other questions asked by whoever their primary care person was, or maybe it was and maybe they just didn't follow through, but they should have said, how is he going to be taken care of at home?
Right.
What steps are you taking to make sure he can take a shower? Right. How are you going to get him from room to room? you know.
And the problem is that we don't see those things in front of us because we're not there.
Right.
And so we see the immediate problem in front of us. We've got a 15-minute time window
Right.
to see, evaluate,
Right.
test, treat, examine,
Right.
and document on
Right.
those people before the next patient's coming in.
Right.
And we don't take the time to really understand what people's needs are anymore. And that really bothers me. And it's prompted me to say, maybe there's a better way we can deliver medical care in this country.
So, TeleMeMD. So, what does that mean then? This means that people just randomly call you when they need you. Is there a membership? How does it work?
I basically have two plans. I have a subscription model where you pay me on a monthly basis. I'm basically on retainer for you at that point. And then if you have a need, you text me, you email me, you call me, and we'll set up a meeting. Many times that'll be a telehealth type meeting. And all those things are included in that subscription fee. There is an additional fee if I need to come out to the house to do something, but it's half the cost of doing so if you're not in my subscription model.
Got it.
The other model is, of course, pay as you go, and so those prices are a little more expensive and are on a per service basis. But there's a lot of advantages to having a subscription type model because not only are some services already included in that, but you also get discounts on things like medical supplies, splints, suturing materials, those kind of things. Everybody gets a 15% discount on that. I get discounts on testing, lab testing kind of things. So I can pass those savings on to my clients without having to go through their insurance.
So at the beginning when we started speaking, I kind of implied that this is an emergency type situation. It sounds like it can be used that way, but can it also be used to replace primary care, or do people still retain their primary care physician?
They can do it either way.
Okay.
I see myself more as an extension of a doctor's office.
Kind of augment that service.
Exactly. Many times patients can't get into their doctor. You know, hey, I've got this complaint or I have that complaint. Oh, we'll get you in next Tuesday. And so urgent care to me is urgency based on what the client or the customer is interested in doing. They need care in a timely manner and they don't want to wait to go in to see someone. So those are perfect instances where my services can come in very handy. I will call and communicate with their primary doctor and send them a chart so that they know what's going on. But it's also really good for people who have mobility issues or just logistical issues. Maybe they don't drive and getting set up to go to the doctor and those kind of things. Hey, if the doctor can come to your home, I mean, we have Uber come to the house and drop off our food.
Right.
Why wouldn't a physician come out to
Right.
your establishment or your home and take care of business?
So like in the case of my mother, before she went into an assisted living facility, this would have been great for her because 8 years ago, she stopped driving.
Yeah.
So getting her to her doctor's appointments required somebody in the family to take time off, get over to her, and you'd spend half a day doing it, and we gladly did it because it's our mother.
Sure.
But this is a way that service can come to her instead of her going to it.
Exactly. It's about convenience.
Yeah.
But it's also about relationship. If you go to an emergency room or you go to an urgent care, many times, or most times, in fact, I don't think you'll necessarily know the person that is there. Or if they come back the next day, are they going to see the same person?
Right.
So having you on file, having a relationship with someone like me who understands where things are at, and you're going to see me, whether you're going to call me on the phone
Right.
or we're going to come out to the house. So
Right.
relationship is important because I think it builds trust and it helps us get to where we need to be in terms of our health.
So health insurance coverage, necessary, unnecessary, indifferent, what role does that play with you?
Health insurance is a difficult thing to tackle. We
Yeah.
all know that. We
Right.
all know that the costs of health insurance are going up. I don't take health insurance at this particular time, and I do that simply for a number of reasons. Number one, it's much easier. I don't have to follow the typical standard of care where you are required, say you had an injury, you blew a knee out or something like that. Many times the insurance companies will want you to go through 4 to 6 weeks of painful therapy before they will turn around and get an MRI done. The other day, for example, I had this very situation. I saw him at 8 o'clock in the morning. By 10 o'clock in the morning, he was in the MRI machine, and by 2 o'clock in the afternoon, he was already in the orthopedic surgeon's office.
So in most cases then, you can pretty much evaluate what needs to happen, but insurance forces you to take this bypass
Correct.
to make sure that those things are, I guess, eliminated as options.
Correct.
And then they end up, getting real treatment.
Right. The dirty side of insurance is that you have to have something for those catastrophic illnesses.
Yeah.
You have a heart attack and you end up in the ICU for a couple of weeks.
Right. You have a stroke.
Those things are
Car
absolutely
accident.
devastating.
Yep.
Those are huge. And those things, I think, absolutely we have to have some type of insurance for. But the other part of it is most people who have health insurance are paying huge amounts in deductibles. And most of us have a deductible that you're never going to touch anyway. So when you go to the doctor, you may pay your copay of $20 or $30, some as low as $10. And you walk out without having paid anything, but it sort of catches up to you a month or so down the road when you get a bill for the doctor that you pay out of pocket because you haven't met your deductible yet.
Right.
So a service like mine, I will be upfront and say it's going to cost upfront. But those costs, I believe, are actually cheaper than the out-of-pocket costs that you spend after the fact going to the doctor.
If someone's self-employed like me, I could be paying anywhere from $500 to $700 a month in insurance costs.
Absolutely.
And I didn't go to the doctor. I haven't been to the doctor in 4 months because I haven't needed to.
Right.
But I still made that payment. So in your case, it's a membership fee that's being paid monthly as an option.
Correct.
Or as needed. So when it comes to the insurance provider, then it would be good for somebody to have catastrophic insurance in their back pocket in case some of those things were to pop up.
Absolutely. There are lots of plans that we could discuss, probably not at this visit, but that you can talk about as ways around those issues. One of the popular things is an HSA. So if you have a health savings account or a flexible savings account, my services are, you can pay for that out of an HSA account. But the real benefit is being able to get a service that is convenient, that it's accessible, that's on your schedule, not the doctor's schedule, and do it for less money. One example of this, and I won't use specifics other than the amounts, is I had to have an ultrasound of my kidney done. So I went to the place I was going to have it done, and they told me it was going to be $139 to get my ultrasound of the kidney done. I thought, well, that's not too bad. Called my insurance company, and they kind of plugged it into the numbers and said, well, you haven't met your $10,000 deductible yet, but you do get a discount, so $139, you'll pay $126 out of that. I said, okay, well, what if I go back to the place that I was going to get this done and paid cash? $72. A lot of people don't know that you can pay cash for a lot of things. So although that has nothing to do with my program, it really highlights the savings that you can do with a little bit of negotiation.
And better care.
And the same level care or better care.
Yeah.
I just think it's amazing that you can actually kind of get those kind of savings in medicine these days.
That is amazing. So how does someone get started with you? Where does it go from here? Somebody's watching this video and they decide, hey, you know what? This sounds like it's exactly what I need. How do they get started?
All right. Well, the easiest way to do it, you can check out my website. My website is www.mytelehealthmd.com.
Okay.
All the information there, pricing is there, and then there's a sign-up page as well.
Okay.
If you want to just call me, my phone number is 419-410-3039, and I would be happy to chat with you, talk with you, text with you. And then I can send you to a site where you can just fill everything out online, and we'll set something up.
Yeah, to me, this seems like it's an amazing service of a necessity that just goes along with everything else that's happening in our lives. So, like you said, food delivery is happening, grocery delivery is happening. That level of convenience is really nice, and in many ways people are expecting it these days,
Right.
but they don't expect it here, and this is an amazing way that they could get that care at home.
Exactly. So I think it fits a wide range of people. I mean, there's some people that think nothing of spending extra amount of money to have Uber bring something out, but there's also the people that maybe they don't have insurance, or maybe you're self-employed. So then there are things that we can even do even further. I do have a business plan where I will talk with a small business and say, you know, for X number of dollars, we can cover your employees, even though those people would otherwise be unable to afford typical health insurance
Sure.
for their employees. So for roughly, you know, $75 to $100 a month, we can cover 80 to 90% of the needs of that individual on a monthly basis for what they